Hi, everyone, and welcome to the NYU Returns webinar for administrators. Please note that this session is being recorded and will be posted to the NYU Returns webinar as soon as possible. My name is Tracy Gardner, and I serve as Deputy Chief of Staff to the President here at NYU. And with me today are Dr. Carlo Ciattoli, who is our Associate Vice President for NYU Student Health, Executive Director of the Student Health Center, and our coordinator of all of our COVID-related health concerns and efforts. Also, Sabrina Ellis, our Vice President of Human Resources, is here with us today. So thank you both for joining us. Each of our speakers will give a brief presentation and then answer questions that many of you submitted through the pre-webinar survey form. If time permits, we'll also take questions that come in through the live Q&A function that is enabled now. And if we run out of time to answer all of the questions, we will review them, track them, and follow up in future communications. So thanks again. I see that we have more and more people that are continuing to join us, but we're going to go ahead and get started. And if folks join us in a bit, they can watch the recording. So now I'll turn it over to Carlo Ciattoli to start us off. Thank you.
Great. Thanks so much, Tracy, and welcome everyone. And thank you for joining the webinar today. I just wanted to touch for a few minutes on some of our decision making and our protocols for the fall semester. I think, were somewhat fortunate as a university to have been open last year. We learned quite a bit. Many of our counterpart and peer institutions were not open last year. Were fully remote for their students and their employees. And I think for us, puts us in a very good position to have a very safe and productive academic year. I want to start by saying that certainly it's not me unilaterally making policy, even as it relates to public health policy. I consult with multiple sources. I'm fortunate enough to have colleagues who work across the public health sector that I can both formally and informally consult with, routinely looking at guidance from the CDC, the New York City Department of Health, the New York State Department of Health, guidance from our professional, or at least my professional association, the American College Health Association, looking across academic public health departments at different universities, including our own, really scouring the literature, the clinical literature, and the public health literature as it comes out to keep as current as possible about what might be driving some of the guidance. And always remembering that guidance is broad. They try to make guidance applicable to as many settings as possible, but it's certainly on me and on us as an institution to take that guidance and apply it locally to ensure that what we're doing makes sense for us at NYU, in the conditions under which we operate, in the setting we operate in New York City, so that, again, we are setting ourselves up for the healthiest, safest academic year possible, while still allowing everyone to be productive in the workplace and our students to be thriving in the academic environment. We certainly don't lock ourselves in. Last year, I know that we, throughout the year, certainly flexed many of our protocols and policies. That will be true again this year. We'll track a number of issues and a number of metrics to look at that, whether that's case counts, whether that's test positivity, whether that's what's happening in the local area in New York City with case counts and test positivity, and looking at the trends for all of that, again, to make sure that we are adjusting our policies and protocols in a way that, again, maintains the safety and health of our community. I do know that one question that has come up, just to put it on the table now, at some point next week, I think we'll reestablish a on the website some reporting dashboard or set of metrics so that the broader community will also have insight into how we're doing week in and week out. I do want to say now a couple of minutes on our layers of safety, the different things that we are implementing to keep the entire community safe. Again, I think core to that is our vaccination policy, where we are requiring everyone to be vaccinated, with the exception of those who get approved religious or medical exemptions. It is core to our strategy. I think for a brief period of time, probably early in the summer, late spring, the vaccines were shown to be so effective that we thought perhaps with that alone we could rely just on vaccination. But again, I think that was probably a little bit of over optimism. And again, we always had planned for multiple layers of safety, so we find ourselves in a good place. We have very high vaccination rates. I know people are interested in where we are. I think we've put it in several communications, but just so people know, we, as far as staff, employees of the university, are probably in the mid to upper 90s now, collectively. I will say, I think this group should take great pride among all of our groups on campus. You have among the highest rates of vaccination, just under 98%. The faculty is right there, right under 98% as well. The union staff and professional research staff, a little bit more in the lower to mid 90s, but collectively, I think those are quite high numbers. And I do also want to just make note, we have a very small percent of that group who have exemptions. It's probably 1% or less among the community. So this really represents people who are vaccinated. So again, exceptionally high rates of vaccination. Among the student population, we're probably roughly in the mid 90s. I think those numbers will actually go up. We had originally assessed that based off of who we anticipated to be in classes for the fall. What we're finding is there's a significant group who has not registered for class and most likely will not be here. So I think we're anticipating student numbers very similar to the employee numbers in the mid to upper 90s at the start of the semester. We have some international students who are just entering compliance as they arrive, simply because they didn't have access to vaccine in their home countries. But as a reminder for people to get access to our buildings, to our events, they either need to be fully vaccinated, or if they are not, for example, having an exemption or only being partially vaccinated, they also must test weekly and have a negative result before they can get access into our buildings. I do want to mention boosters briefly, only that we are fully aware that they are something that will be out there and will be recommended probably within the coming weeks. We've touched base with the City Department of Health. We have an established site in the lobby of Bope's Library for mass vaccination. And should the FDA approve boosters, we will do what we can do to facilitate all those who are eligible to get booster vaccines when the time comes. Again, while vaccination is core, and I think there's a lot of discussion about breakthrough infections, which we knew would happen, even if we didn't have the Delta variant, we do know that vaccines are providing exceptionally high protection against severe disease, so that most people who do have breakthrough infections are getting exceptionally mild disease or are asymptomatic. So again, knowing that we would have a few breakthrough infections, we have multiple other layers of safety. Next of which is our universal masking policy. So we do ask everyone to mask at all times indoors, except that they're eating in a location that we've designated as an eating location. And again, really then minimizing the time your mask is off to no more than 15 minutes. We will have masks available throughout campus. I think the locations will be up on the website. Again, at this point, most people have ready access to masks, but again, we will have some available throughout campus. And we will continue what was, I think, a very successful public health ambassador program. They will also have masks out and about, again, encouraging people to wear their masks appropriately. I will add, we've added a little bit more content to the website talking about masks, how to ensure a good fit for your mask. So I would encourage people to take a look at that as well. I want to talk next about testing, and we have multiple arms to our testing program. We have required testing, as I said, for anyone who is not fully vaccinated. So for that group to get access, again, to campus, they will have to test on a weekly basis. We have indicated testing as another layer. Anyone who has symptoms consistent with COVID, or anyone who was deemed to be a close contact by our own COVID prevention and response team or other public health officials are also expected to test. We have another arm, and I know this has come up in some of the questions, that we're calling discretionary testing. So you can access our BINC sites for discretionary testing, our BINC's distribution sites. If you feel that for whatever reason you were in a situation that might be higher risk, you had recent travel that was perhaps prolonged on a plane, you were in a crowded, sort of large event, you were in an indoor space where for whatever reason people were unmasked, that might not have even happened on campus. So we are allowing people up to once a week to, at their own discretion, test if they feel they need to. Again, testing is almost now universally available at every pharmacy, urgent care center, and if people want to test even more frequently, they are more than free to do that as well. And then the other thing that we are exploring is some degree of random surveillance testing, where we will take a random sampling of our vaccinated population and test them as well, and collectively use all this information to see how we're doing on campus. While we no longer have a distancing requirement like we did last year, there are still situations where we are asking people to maintain physical distance. That is largely our unvaccinated population at larger events, where we will ask them on the honor system to distance. And then during people who are eating indoors, we are also asking them where possible to maintain, and that would be everyone, 6 feet of distancing as well. We are making attempts to reduce density on campus somewhat by restricting visitors, vendors, and affiliates to those who are critical to the core mission, academic and research missions, as well as being critical to the day-to-day operations of campus. They will still be expected to go through verification of vaccination or testing based on their vaccination status. We have put out guidance around meetings, gatherings, and events, again, to minimize large, more high-risk events and avoid super spreader events. And we also will continue our case management of positive cases of close contacts through our COVID prevention and response team. One of the most critical aspects of managing COVID on campus is to find and identify people who are positive, isolate them quickly, identify close contacts, and among those close contacts, if they're vaccinated, have them test 3 to 5 days after the last exposure. For those unvaccinated, they still are required to quarantine. Ventilation, not to say too much about this other than to say our VP of Facilities and Construction Management, working with her team, has done a broad audit of the university, ensured that we are meeting or exceeding all standards for air exchanges, making sure that maintenance is up to date, filters are changed. So that process has happened as well. We have not forgotten about ensuring that everyone takes responsibility themselves, whether that's in the form of hand washing, which again is good for all respiratory viruses, not just COVID. Even though I think at this point we have learned from the science that contact transmission or surface transmission of COVID is probably not a significant mode. Certainly frequent hand washing is still good for minimizing other respiratory viruses as well. And then again, we are encouraging anyone on campus, whether it is a student or employee who is sick, to stay home, get tested right away. If they're negative, then they can return once they're feeling better. Obviously, if they're positive, they would then report to us and we would manage it appropriately. Certainly a lot changes. We always, again, will be willing to flex some of these as things hopefully get better. I will say sort of a glimmer of hope is that if one looks at the city's dashboard, almost all their key metrics are headed down in the right direction. So we historically have always followed the general direction of the city. So we will sort of see how the first couple of weeks of the semester goes, but it does give me some source of optimism heading into the fall semester. So I will stop there and see, Tracy, what questions we might have.
Okay, we have a couple of questions that were submitted in advance, as well as a couple of questions that came in through the chat. What I will note for folks that are submitting questions through the live chat, if your question is not on topic of this webinar, we will follow up in a future communication. So just as one example, I saw a question about student conduct. And so that particular question is outside of the scope of this webinar, but we will be sure to follow up in future communications. So the first question that came in advance, someone said, I'm sorry, give me 1 second. Someone said, I'm looking at many of these that were already answered. And so I'm trying to get ones that haven't been answered. But just to reiterate, no, actually, I think all of the questions that were asked in advance have been answered. So give me 1 second to ask a question that came in live. Someone asked about a concern about staff who don't have private offices. And the question says, with administrators not required to mask in their offices, administrators in these offices are a bit more at risk than those with walls that reach the ceiling. Could you please comment on this?
So I'm sorry, Tracy, is this the general issue of just being in the office, not in a private space with other employees?
Yep.
Yep. So, I had a conversation earlier in the week with the Department of Health just to get their sort of sense of how much risk do we really have where we're not distancing anymore. And the feeling was from him that someone who is vaccinated, who is asymptomatic, who is masked, really poses no risk or very little risk to anyone else. I think it's what we built our fall planning around with going back to, normal capacity in the classroom, relatively normal capacity back in the workplace, that even with Delta variant, that risk is exceptionally small. And again, the fact that we've got such high vaccination rates, a universal masking requirement, makes, I think, both the classroom and the work environment safe for all.
Thank you. I noticed that someone asked a question about what types of masks will be available. And I just want to note that Dawn posted a link to the PPE distribution locations in the chat. So that information should be available there. Carlos, someone asked if NYU is providing flu shots this year.
I mean, I think the short answer is yes. We'll certainly provide them to the students, and Sabrina could probably answer on the employee side, but I think we've been doing it for as long as I've been at NYU, which is 20 plus years. So I am guessing yes for both students and employees.
Okay, great, thank you. So in the interest of time, I'm not saying that we won't get to more of the health related questions, but I'm going to transition for a moment to Sabrina Ellis, our Vice President for HR, who will give a brief presentation. I will pose a few questions to her, and then we'll keep it going. So I'll turn it over to Sabrina now.
Thank you, Tracy. Good afternoon, everybody. Thank you for joining us on this webinar. For those of you who are checking your email, there was a community message that went out from me yesterday. We are together again. We are NYU together again. And in that message, I just want to reiterate some of the key themes there. The first, of course, was gratitude and appreciation for the way in which everyone's pulled together to help to get us through these months that we've been dealing with the pandemic. We, of course, have had many thousands of employees who have been working on campus since March of 2020. And we are, of course, very grateful to them as they've continued to perform their duties, which could not be done remotely. And then there, of course, are those of us who have been predominantly remote since the start of the pandemic. And so everyone has really come together and worked together beautifully to help advance the mission of the university and the work that needed to be done. Of course, this has been simultaneous to most of the world being remote. And so as we know, as we're seeing, many of our folks in New York City, New York State, and even across the country are starting to slowly make their way back to the workplace in a more formal way. And so, of course, for those of us in higher education, that is, of course, true and has been true for NYU. There have been many people who've started to make their way back, but we have continued to move forward with our return planning. And that has included aspects of all of the review of data and assessing what our peers have been doing within higher education in the city, in the state, nationally, as well as looking at what other employers have been doing and trying to stay on pace with what we're seeing from others. We're not an outlier, I think, here. And so we have good company in really all aspects of our return activity. In line with that, we have been fairly, I think, prescriptive in how we have clarified messages around things like remote work. Of course, we took the unprecedented step in March of 2020 to transition to, again, a predominantly remote setting for most administrators and faculty. And since the last summer and last fall, we've been slowly but surely making our way back, and offices and units and schools have been ramping up, and that ramp up has, of course, continued over the summer. Delta has certainly posed challenges for all of us here in the United States, and we are doing our best to try to counteract the impact of Delta. And as Carlo has said, he, of course, at the forefront of our health planning, has done a phenomenal job in helping to keep us safe as a community, and also coordinating with our various groups and schools across our student groups, our employee groups, to make sure that we're all, in unison in how we're making our return back. This past May, we issued guidance to the schools on what remote work and what a transition back to campus for the fall would look like. And aspects of that guidance included messaging, which you've heard Marty and I talk about at AMC forums and in other meetings, has included guidance to the schools that decisions around remote work largely should be made based upon the type of work that's being performed, the needs of the unit and of the school. And we have seen schools and units follow that guidance. We've also more recently issued guidance where we have reiterated aspects of that message. And we have also said remote work can and should be used to de-densify. And just a note on that. I've gotten many questions about remote work, and predominantly there sometimes can be a default definition of remote work to include 5 days a week or whatever the schedule might be, but 100% remote. And so just to clarify the message, remote work does not by definition mean 100% remote, because we do have many different kinds of remote work happening at NYU. Some of that could be remote 20%, 40%, 60%. We have not adopted the position that 100% remote is the desired default. Far from it. We've said that we certainly would be open to schools and units adopting sort of a hybrid approach where you may have folks in 2 days, out 3 days, or some variation therein. But we've not in any way adopted the position such as what we may have taken in in March of 2020, where we were essentially all predominantly remote. So that continues to be the case. We have given guidance to schools and units, again, that duties should be really at the forefront in how remote decisions are made. We've heard from folks within the community questions as to whether or not the university will take a centralized approach in defining which kinds of jobs might be conducive to remote work. And we don't have a framework to centrally approve those kinds of decisions. And really, it's not in keeping with our general operating principles of allowing schools and units to make those decisions based on the needs that are occurring at the unit level. So we're keeping with that guidance. But we have, I think, been able to successfully transition back for the most part. And we're going to continue to ask for your help and cooperation in making that transition. We know that folks are concerned about subways and riding on mass transit, both from a public health perspective, which I think we're all thinking about, but also from a safety perspective. And we've heard folks say to us that crime is up, and so their concerns about traveling on mass transit have heightened aspects of their anxiety. And so in order to address that, we have worked with our Office of Public Affairs as well as our Office of Web Communications to launch a commuting hub where you can link up with folks or connect in with folks who may have a similar commuting route that you take. And then, folks can buddy up who are taking similar routes so that you don't have to commute in by yourself. Otherwise, following all of the good guidance that you've heard from Carlo and that you continue to hear from public health experts about wearing a mask and following that guidance, as well as hand washing, just general hygiene, not touching your face, your nose, your mouth, and trying to just maintain those very basic levels of hygiene protocols, which are good in any year at this time of year, but particularly important in the midst of still having to deal with the pandemic, and also, of course, with having to deal with Delta. So for the most part, we're continuing, and we are optimistic that we'll be able to get back. We do have a residential campus, and the needs that are put upon us as an organization are different than what you may find in some other employers that you might see referenced in the news. But we're continuing to make our way back, and we want to thank all of you again for your cooperation and your help in allowing us to do that. So I'll turn it over to Marty Dorff, our Executive Vice President, and Marty also will provide some remarks.
Thanks, Sabrina. So I think Carlo and Sabrina have actually covered most of the points I wanted to make. I think it's helpful, for this group to have some understanding of how we're approaching these decisions and how we're approaching these protocols and policies. I think it's understandable in the current environment for there to be a lot of uncertainty. And the reality is that even our perspective and our decisions have continued to evolve even since as the earlier spring, when, as Carla mentioned, I think we were more hopeful that the vaccines would have had broader use and, frankly, a broader impact than where we are right now. And I think that's the most important point to make, which is our decision making is not static. We're not making a decision and sticking with it forever. As we gather data, as we see what the impact on you, on students, on faculty is of our operating plans, we can pivot. That's one of the reasons why even recently we've decided to expand our testing protocols. It's why we have continued to evolve our thinking around things like eating spaces and so forth, because we're trying to adapt to the circumstances as we come to understand them. I think the other main policy, which addresses a point that has come up repeatedly, is the fact that we are an in-person operation, and we owe it to our students and our community to the extent possible and to the extent balanced with good health standards, to actually be here in support of students. It's the experience that they've expected to have, and it's what we would expect to give them. That being said, we certainly are open to opportunities for remote work if the nature of the work lends itself to remote work. But we don't want people just gone from the campus and gone 100% of the time. We don't think it creates the kind of atmosphere on campus that is consistent with the kind of university we want to run. We know that that leads to different circumstances for different employees. Some need to be here more, some less. Many of you, well, all of you know that even in the height of the COVID outbreak a year ago, we had any number of people that were regularly coming in and performing the necessary functions that that we needed to keep the campus operating. So I know it's not an answer that satisfies everyone, but as a policy matter, we just think it is a necessary thing for us to have an in-person operation that supports our students, faculty, and you. But we are, as Sabrina said, certainly open to the opportunities for remote work when the nature of the work lends itself to that. So I'm just going to stop there. And I know there are a lot of questions. And I know we've tried to pop a few answers up into the chat. But why don't I turn it back to Tracy, and maybe she can MC us through the rest of our time here.
Okay, I have lots of chat boxes open and looking at lots of questions that are coming in real time. So here's a question. Since we're not distancing any longer and will be in full classrooms, is there any value to encouraging double masking as an extra preventative method?
So I will say that the most important thing is ensuring that the mask fits properly. So if you go to the website, our website, we pulled some instructions about how to ensure a good fit. One of those ways of ensuring a good fit is to double mask with a sort of surgical mask underneath and then a cloth mask on top of that, because that tends to seal in some of the gaps. So double masking in the way described on the website, whether it's ours or the CDC website, is a way of ensuring a better fit of your mask. There are other ways of doing that. You might see with the surgical masks, sort of tying the loops a little tighter, and other ways, again, of ensuring a better fit. But double masking in the way I described is one way to ensure a better fit of masks.
Thank you. Another question, there is some anxiety surrounding the idea that people can be non-compliant and that their identities will not be shared. Trusting those who choose to be non-compliant to the honor system seems worrisome. The question is a little long. I'm trying to.
Now, I read the question, Tracy. Let me jump in and try and address that, because I think it starts with a faulty assumption, which is those that are non-compliant, and that means someone that has not either vaccinated or hold a valid exemption. Those individuals are identified and identifiable. Our screener system results in those individuals not receiving a green screen, but a yellow screen. Our campus safety officers are then in a position to actually deny them entry to the spaces that we've indicated, the sort of public use spaces, gyms, dining facilities, other kinds of public spaces like that, that we've told people we don't want non-compliant individuals to be in. We've also made the list of non-compliant individuals available to university leaders, the deans and unit heads, who are sharing them as necessary with the supervisors that report to them, so that in fact they can make sure that folks do follow the rules, that we're not leaving them to their own devices. And I'll just make this last point. Obviously, we wish we were 100% compliant, but at this moment in time, we're pretty happy with the high percentage of compliance that we actually have. By way of example, we're under, in all of the administrative and professional employees, not just members of the MC, but anyone who's non-union and non-faculty, we're under 100 people who are non-compliant, and that number is going down regularly. I can tell you also that we have asked every dean and unit head, we gave them the list of non-compliant individuals and have asked them to do personalized outreach, actual phone calls to each of those individuals to A, encourage them to become compliant, B, offer any opportunity for counseling. I don't know how many times we've had Carlo ending up on a phone call with someone. And C, find out whether their non-compliance is for that individual matter of principle, or just an accident of either not having the information or not having been completely through the vaccination regimen yet. I can tell you, it's admittedly anecdotal, but in most of the units that report to me, my direct reports have come back and said, with very rare exception, and I'm talking literally now less than 5 people, everyone that was still listed as non-compliant was planning to become compliant by the time the semester had started. Some were still in the vaccination protocol. Others had just not yet uploaded because they didn't think they needed to. So the non-compliance issue, believe me, we take very seriously, and we're working the issue very hard. And we do know who is non-compliant, and we're working with supervisors to get those issues addressed.
Thanks, Marty. This question is for Carlo. My doctor expressed concern that we're seeing Delta variant being transmitted outdoors. Do you have any guidance on this front, particularly given the strong encouragement for folks to eat outdoors?
Right. So I don't know that there's any definitive evidence that being outdoors, there is significant transmission. I think we never say never, or we never say always in any situation. This is about relative risk. So what is clear is that being outdoors has less risk than being indoors. So I think if we sort of look at the broad suggestions around eating, and people have to eat and they are outdoors, if they have the opportunity to maintain some distance and they limit the eating to perhaps no more than 15 minutes, that is a much safer environment to be in than being indoors. So I think we would continue to strongly urge people when they can to eat outdoors. We know it's not feasible in all situations, but basically to use that broad guidance about trying to keep the amount of time limited, where you can space out a little bit more when you're eating. And again, certainly outdoors, the likelihood of transmission is much less than it is indoors.
Thank you. Another question for you. Why are event precautions so rigid with capacity, but classrooms are functioning at 100% capacity?
So I think one has to remember what happens in a classroom, particularly larger ones, versus what happens at an event. Larger classrooms are almost exclusively lecture style, where the only person doing the speaking is generally the instructor, and that everyone else is seated, really fixed seating, versus an event where there is often a lot of interaction, where the intent is to have a lot of interaction between guests. I know that we've seen historically a lot of outbreaks at social events. And while we created guidance around it, I think, again, it's a little bit of a mischaracterization that this is sort of rigid guidance. What we did is create guidance that would allow people to host events if they met all the criteria. They could still host events if they didn't, but those had to go through a process of consultation so that we could work through how to ensure that we have that event in the safest way possible. So whether is it a size limitation that is the issue, because I think we've set an indoor limit of 250. We have made exceptions to that, again, where we said, well, if it's fixed seating, much like a classroom, and it's sort of a guest lecture type of thing, that would be okay. Limiting any access to food indoors. So a lot of people want to host events with food indoors. Again, we've generally said no to all of those, again, because those are greater risk. So where the event ends up looking more like a classroom setting, we've generally said yes to those. And again, this was just a way to facilitate members of the community being able to host events, meetings, and other types of gatherings without having to come consult with us on every single one. But where those conditions weren't met, we work with the host organizer to ensure a safe event.
Thank you. We have a question. How can I get my ID card renewed? Some people, just to give a little context, in these last few weeks, as more and more people have been returning to campus, some people's ID cards are not working, and we've gotten reports or inquiries like, I've submitted all of my paperwork and I can't access campus. And so what we've noticed is that in most cases, if not in all cases, these were employees whose ID cards had expired while we were working remotely. And so we just want to share information about how folks can get their ID cards renewed if necessary.
So,
Tracy, they can go to the NYU ID Card Center.
The only thing I'll tell you is that Welcome Week is not a great time to do that because there's about 5,000 freshmen doing exactly the same thing. Excuse me, first year students doing exactly the same thing. So, so if it's possible to wait, or actually just a few more days, that you'll probably have greater success.
Someone else wonders if you might address whether additional financial support will be available to working parents at NYU, given the pivoting nature of COVID and how it affects school-aged children.
So let me start with a general statement, which is that we're looking at the issue more broadly, you know this, Tracy, around dependent care and family care issues for all NYU employees, not just built around COVID, although clearly the COVID situation has heightened our sensitivity to it. But we've had a mixed bag of child care support programs for our different employees, and we do think it is, and dependent care, not just child care. We do think it's an issue that needs to be addressed more comprehensively. So I can't give you the specific. Well, the specific answer is at this moment, no, we're not going to be doing handing out more money. Sorry about that, but we are going to be trying to develop some broader programs and principles that'll work for everybody. I don't know, Sabrina, do you want to add anything?
Okay, so here's—
That sounds right. Thank you.
Here's another one. Can we know what standards are used with reference to the HVAC or HVAC system?
Yeah, I put that, I responded, I think in the chat to everybody. I think it's there. If not, I can send it to Dawn. It's one of the public chat. It's one of the first items at 4:21 p.m. Is that in everyone's outbox? I sent it to everyone or inbox. Hopefully
Okay.
it's there.
I think this question is for Carlo. Carlo, someone asked about why we're not accepting tests other than, or test results other than banks and BioReference.
Right. So, as we've been talking about over the last 45 minutes or so, one of the ways that we're ensuring the safety of the entire community is to provide for that sort of daily screen or green pass, or for that very tiny group of people, the yellow pass. And what that does is it ensures that someone is either fully vaccinated or that they have tested on the schedule they're supposed to test on. And the way to make sure that we expedite that is to do it through our 2 testing programs, which is through the Binks kits or through the smaller BioReference testing, which is available on Cooper Square. And that way there's essentially a sort of real-time feed so that we get the results back quickly, so that people are not having to upload or send us test results, have it validated, us have to go back to them and say, we can't read your name. They're upset because they're standing outside their office or outside a classroom. And I think that process has worked quite well in facilitating the testing. And I think you see that as a general standard across higher ed. Now, it doesn't preclude anyone from on their own, if they want to do anything above and beyond required testing to go locally somewhere, they should certainly avail themselves of that if they want to.
Thank you. Here's a question. What if I think this is sick. What if a sick employee comes to work, one that usually, or a super employee, meaning that they may be like a superhero employee. What if a super employee comes to work, one that usually comes in even when sick? How do we deal with that colleague without being zealously abrupt? Sabrina, I think you wanted to answer that one.
Yeah, thank you. Thank you to the person that asked this question. We have put out guidance since the start of the pandemic that if folks are sick and experiencing those COVID-like symptoms, we would like you to stay home. And it sort of relates to a second question that someone asked, and thank you for this question about, how does it work with taking sick time and in remote work. And so what we've said is, if you are able to work, you're experiencing COVID-like symptoms, and you have a job whereby, it is conducive for you to work remotely, that is, something that would be acceptable, provided that your supervisor in your unit agrees that your work can be performed remotely. For those who, can't work remotely, either, you truly don't feel well and you don't want to be at home trying to log into Zoom and be on Zoom all day, you take a sick day. And so for the sick leave policy, you do use your sick time. And an exception to that is if you are under a mandated order of quarantine, which there are very few of those. We had those early in the pandemic. We don't have them so much now. But if you do, if you are experiencing COVID symptoms or even have been diagnosed with COVID, you are using your sick time. And we have tried to eliminate any incentive that would necessitate someone with COVID symptoms coming to work. So we don't want folks who are, legitimately experiencing these symptoms to feel like I'm going to get docked and I won't get paid, and therefore I'm going to show up even though I know I'm not well. So what we want you to do in those instances is to be in touch with your HR officer. most folks, this is not an issue. We grant very generous sick leave at NYU, and for most people, this would not be an issue. But if, for example, you are someone who would perhaps be in a situation where you may go into a negative balance, we would want to be aware of that, because we want to make sure folks are not put in an unpaid status if they are, experiencing these symptoms or in fact have COVID. So this question comes up a lot. I hope that that's clear. I know that there might be other subsequent follow-up questions that come up as a result of that, but that for the most part is what we've been following since the start of the pandemic.
Thank you. Here's another question. Many other reputable companies in the city are pushing out their return to office dates as a result of recent developments, coupled with staff being able to perform their job duties with no issues virtually. This seems like a missed opportunity for NYU. And there's not really a question mark there, but I just wonder if anyone would like to address that issue.
Yes, the brave soul who asked this question. Thank you for asking the question. I think there were a couple other questions on this. And this is something that has come up. So one, and I did send an answer directly on this, and I did say that I would answer it live because it has come up. We have groups and teams who are looking at remote work on a longer term basis. We have a management fellows group that we have launched that is looking at remote work. We acknowledge and agree that remote work can be a really effective tool to the extent that it allows us to fulfill all of our other, mission-based activities. But even there, lots of times folks raise organizations that don't have residential student communities. And one really large distinction about NYU is that we have a really large residential student community. So with that, there are needs of that community that arise 24 hours a day, 7 days a week. And even when we don't have students on campus, there are activities that we engage in to get ready for the next set of students that are coming. So we are not benchmarking against the Ogilvy's and the EYs and the Bank of Americas in this regard, but we are doing a very careful and thoughtful study of how we can leverage remote work in the ways that some of these organizations have also done it. So it's not a project that's going to be done overnight. Nothing at NYU happens overnight. We do try to be thoughtful, and we do try to give careful consideration to this. So I do want folks to know that we do have a project. We do have teams that are looking at it. We are looking at pilots where we can, again, explore this, but we are not thinking of the mindset that 100% remote work is the model that we want to adopt. So, we're working on it, and we're hoping that as time goes on, we'll have some really good, thoughtful feedback and planning that can go with thinking about this and looking at this on a more sort of exhaustive basis. And a more thorough basis. So we're not missing the opportunity. We learned a lot from remote work. We've heard from you about your thoughts on it. And I don't want anybody here, that's why I pegged the question. I don't want anybody here to think that experience is lost on us. We are thinking about it. We are working on it. It doesn't mean everyone will have the option to be remote, as Marty, remarked. Jobs are different, demands are different, needs are different, operations are different. But it does mean that as a university, we are going to take the learning of the last 18 months and try to emerge as a better, more efficiently running university. So more to come on that, but I do want everybody to know that this is something that we're working on.
Thank you. We have time for just a few more questions live. And so this one is for Sabrina. NYU has communicated that in-person meetings should only be conducted if they are essential. My supervisor desires to have monthly team meetings in person. What should I do if I feel like I'm being forced to attend in-person meetings that are not essential?
Yeah, so this is a good question. And just to reiterate, Carlo has put out really helpful guidance because we have a strong meeting culture at NYU. We have classes that are convening every day, all day. And so, but what we have said is that for administrative operations, we do, unless it is an essential meeting, we would prefer that it be a virtual meeting. And so in this instance, again, we have given schools and units agency to decide what essential means. And we're not providing a centralized definition of that. Most of us know essential means, must happen in order for something else to happen. That's critical. But, you can always be in touch with your HR officer or your HR business partner if you have concerns that this aspect of our return to work guidance is not being honored. And that's true for any aspect of the return to work guidance as it relates to, there were other questions I think that came up about, if a supervisor doesn't agree with aspects of it or isn't adhering to aspects of it, you can of course be in touch with your HR officer, your HR business partner, and then they'll work with employee relations to try to determine what the appropriate next steps are.
Thank you. One more question. If we have access to a private office for a day, are we still better off eating outdoors? This is a two-part question. Should everyone try and eat outdoors as quickly as possible? And just relatedly, for Carlo, there have been questions about the 15 minutes recommendation and whether that's like hard and fast or a guideline. So if you could say something about that, that would be great.
I think at the end of the day, again, it's sort of managing risk overall in terms of, indoors versus outdoors. Obviously, when you eat, you have your mask down. And I think we've seen the benefits of being masked. So, certainly eating on campus is going to be a challenge, particularly as we head into the colder weather where eating outdoors becomes less of an option. I think, again, going back to what we said earlier, being outdoors, just a larger space, breeze, greater ventilation, all things being equal, you probably should be outside versus inside. If you can't be outside, a private office is probably the next best thing because you are probably insured that you are not near anyone else with the door closed. And on the 15 minutes, nothing magically happens at 15 minutes. It is the definition of close contact. So again, it's the less time I think you can have your mask off when you're with others, the better. We sort of have set 15 minutes for a host of reasons. One, for public health reasons. Two, if we do have designated spaces indoors, we want as many people to be able to access them. That's true in our dining halls for students. That's true in our spaces for employees so that everyone has an opportunity to eat while they're at work. So it serves two purposes. One, the public health, two, the simple access to an eating space indoors.
And if I can just add on, I think this is one of those areas that we as decision makers have struggled with because of the issues, in terms of the kinds of space and the differences in the kinds of space available for people. So my guess is you're going to hear more from us on this before, we're not stuck in one place. As I said, we are continuing to evolve our thinking. We know we need more space inside to allow people to eat. The trouble is the students do as well. And actually, overall, the amount of lounge spaces that could be available are less because of the way we've reconfigured a lot of the operations on campus in the last year. So I know this is a hardship for some of you, and I know it feels unfair. All I can tell you is we're going to continue to try and work this to make it work better for everyone.
Thank you, Marty. And we're at 5 o'clock now. And so I just want to first acknowledge the fact that there are still questions in the live Q&A that we simply did not have time to answer here. And I know that that can feel frustrating at times for folks who submitted the questions. I want you to be reassured that we see your questions. We hear your concerns. We will take your questions and share them to the appropriate people who are in charge of those areas and follow up with responses. Please note that while the response may not be a direct email response to your specific question, we will incorporate information related to your questions in future communications. So again, I just want to thank you for asking some really great questions and reassure you that we see you, we hear you, we know and sometimes share your concerns, and we'll follow up with you as best as possible. So with that, I just want to thank Sabrina, Marty, and Carlo for speaking with us today and for all of your tremendous efforts over the last, I guess it's about 18 months now that we've been in this struggle together. And I also want to thank each of you for your forbearance and perseverance and hard work. I also want to note again that this webinar is being recorded. We will put it up on the NYU Returns website as soon as possible. It takes usually about 48 hours or so because we have to make sure that all of the closed captions are done legibly so that we meet our accessibility, our digital accessibility standards. So with that, I hope that everyone, if it's raining as hard as it is where you are as it is here, I hope that you stay dry and we all continue to do our best to keep ourselves, each other, and all of our loved ones safe. So thank you, thank you, thank you.